A common question that we hear quite a bit as general OBGYNs and urologists is it normal for women to leak urine? And the answer to that question very simply is no. It's never normal to leak urine. Now, urinary incontinence is actually a very broad subject. There are many different types of incontinence and many different causes for incontinence, which is why it's always oftentimes good to see a specialist who handles just these types of problems. Urogynecologist, specialist in female pelvic medicine and reconstructive surgery, specialize only in this type of work. We're either boarded through the American Board of Urology or the American Board of Obstetrics and Gynecology. It's never normal to leak urine. Urinary incontinence is not uncommon in the early ages or late ages. At least 1 in 4 women in this country will have a problem with this at some point in their lives. And the problem is usually progressive. We do see more of our patients after the menopause who have these difficulties, but it usually starts in most women's 30s and 40s. Childbirth certainly plays a role because it oftentimes leads to compromise of the structures that surround the bladder, such as the uterus, the vagina, the rectum, and other support structures that help support the urethra and bladder, which is our major way of holding urine. The bladder doesn't actually make urine, it only holds urine. It's a storage device. And it's a dynamic organ. It changes with us, it moves with us. And as we get older or have insults to the pelvis, such as childbirth, surgery, things of this nature, we have difficulties with holding our urine. And specialists in female pelvic medicine and reconstructive surgery look at these problems as a global problem. We look at the entire pelvic floor because most of these structures are interrelated. So if you have difficulties with leakage of urine, whether that involves urgency, leakage with coughing or sneezing, or loss of urine without any sensation at all, a good place to start is with your urogynecologist. For more information, please consult our video library or make an appointment and speak to your healthcare provider at Women's Healthcare Associates.